the Health and Human Services Committee to order. It is 4 p.m. on June 5th. Legislator Jonathan Anna.
Present.
Stephanie DeVito.
Yeah.
Hans Petcher.
Here.
And Mark Strong is excused. I am here. I'll have all of us rise for the Pledge of Allegiance. There is a flag right behind us this way. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We have minutes to approve for both April 3rd and May 1st.
Make a motion.
Second.
Any questions or discussion about those minutes? All in favor?
Aye.
Passed. We do have a very recent update this afternoon, an appointment to the Mental Health Subcommittee. It is listed here again. We don't take any action here at committee. We will take action on this at the full legislature, so it is for your information. Any questions about that? Okay, we're gonna move right into department head reports and resolutions. I'm gonna call Lauren Walsh. I'm gonna do some things out of order today, based on some requests and personal needs. So Lauren Walsh, could you present and then go through our resolutions after?
Yeah, so I don't have a ton of updates other than, we have had quite a few applications and interviews for social work positions, more so recently than we have probably in the last year. So we are hopeful. We filled one position that she'll be starting beginning of August. We do have another one that's sort of semi-committed, but she needs to figure out some daycare stuff, and then we do have a couple more interviews set up for next week. So crossing my fingers, I'm hopeful about those and filling those positions. And my resolution is kind of an update as well. So, I don't know if you want
You wanna move right to that?
So this is accepting an OMH grant for our clinic to be able to offset some of our mobile crisis therapists non-billable time. Basically what this is it's about outreaching to people who are either, so we have a good process now of people who are admitted to the DHU at the hospital and then are discharged. If they miss their hospital discharge appointment, of following up with them. But this will be one extra step that mobile crisis will be able to continue to outreach if that person is unable to be, getting a hold of on the phone, or they can go to their house and visit, just to kind of make sure we don't lose people after they're getting out of the hospital. The biggest piece of it, the newest piece of it, would be the emergency department. So we've never really had good kind of like planning when somebody goes into the ER for mental health reason that's not going to inpatient, of what that looks like when they're told to walk in, or they're told to do an intake appointment with us, but there's no like connecting of that. So what it's gonna look like is the hospital social workers will be able to call, we'll have a number set up, they'll call, leave a message if the patient is open to it, if they give consent to having someone follow up from the house. So our mobile crisis team during the day will be the point people for that, and they'll be able to call and or visit depending on the level of risk, and that we hopefully aren't losing people kind of in the cracks as they get discharged from the hospital, or end up turning around and going right back into the hospital. So hopefully that will help alleviate some of that and get people connected to where they need to be.
Can I have a motion to put HH8 on the floor?
Move it.
A second?
Awesome.
Thank you. Any questions or discussion?
Can I just ask the one clarifying question?
Yes.
Because you do have the ability to bill under mobile crisis for certain particular things, this follow-up is where the grant will come in. Those would be not billable hours to try to make you whole there.
So some of them could potentially be billable depending on the level of risk of the referral process, but I would say a lot of them will end up being non-billable.
So this money will offset some of that administrative
Yes.
time.
Yes. Good, that's good.
I have a question as well. Will mobile crisis workers be able to then actually go into the ER when you say they respond, or will it mostly be phone?
It'll mostly be referrals from the ER. They probably won't be going into the ER at
Okay.
this point. Just because, I mean, those discharges can happen at all different hours, so we'll
Right.
just be making sure that our team knows about it and we'll be following up the next day.
Okay,
So not at this time will be necessarily going into the ER.
so really the involvement of the mobile team comes at discharge if consent is given.
Yes.
Okay,
Yep.
thank you.
Yep.
That helps me. Any other questions, discussion? All in favor of HH8? Any opposed?
49,500.
Any opposition? So carried. Thank you. Anything else?
Thanks for letting me go first, I know.
Okay,
Wonderful.
Brenda, why don't we speak to you as well? Because I think we do not have any resolutions from you. So can you give us your update?
Okay, sure. So I submitted a report, fairly brief, fairly straightforward. I just wanted to talk a little bit more about our Medicare 101 classes. We do offer those every month. And as I was leaving today, our June class was starting. And we do make a point of doing evening classes because sometimes people really prefer that. And we definitely get more numbers in the evening. So I was glad to see that, glad to see the room look filled as I was leaving. So I wanted to just clarify, realize 2 OFA staff recently concluded a very successful 6 weeks of powerful tools for caregiver sessions. I just wanted to clarify that is actually caregivers who come into our building, meet for 6 weeks in a row. It ends up being just a really symbiotic relationship. They actually are able to connect with other caregivers who are in the same kind of situation, dealing with a lot of the same issues. It's a very powerful class. It really makes a difference. And often these individuals will go on to continue to communicate. This group shared phone numbers and emails and everything when the class continued. So it's a facilitated evidence-based program for 6 weeks. We tend to have small groups, but it's a very big impact. So I just wanted to clarify that what that was. And then I just wanted to thank everybody again for recognizing our 3 senior citizens of the year at the May Ledge meeting. That was, they talk about it for days and weeks afterwards. It's just such a nice thing. And then we did have a beautiful day for our volunteer picnic yesterday. We had about 75 attendees. It was a perfect, wonderful day. I thank the legislators that attended and their support. And it was such a nice time to show our appreciation to those volunteers. I didn't bring the numbers from the resolutions specifically. We have over 85 volunteers. They do over 7,000 hours a year of service delivery. I don't know the number of miles they travel. It's a lot. But in terms of actual hours that they give to us, it's a savings to the county of well over $113,000 every year because of their volunteer service. And that's a very minimal number. If it was employees, I think the hourly would be a little bit higher. So anyway, the participants really enjoyed it. It was a really nice group. It was one of our best picnics. And we're just very glad that we could do that. So I wanted to mention that.
It's well organized, well done. Thank you.
Great team, great group.
And we were serenaded.
I wasn't gonna bring that
You know,
up.
because I'm gonna invite everyone to next year's picnic because Brenda and I will be doing a duet. Just to bring that up.
I was severely dehydrated yesterday. I was not in my right mind. I did not agree to anything.
She got Julie Howard to say, Jonathan Adam wants to sing a little song for the picnic. So we
Yeah.
got up and did one.
Well, when everyone claps and stuff,
For
I
real.
missed it. You know.
Yeah.
Nobody took video?
Oh, darn you. She get with the times.
Gosh.
Yeah, well, it's okay. That's why Brenda and I are doing it like next year. So make sure y'all come out for that. It'll be entertaining to say the least. But it was a great picnic. Lots of people, I think people are very appreciative of it, and it was great to see all the volunteers enjoy ourselves. Thank you.
Mhm. Thank you. Okay, so moving along, we'll go back up to the top of the agenda with Kathleen Cuddy. Health Department.
Okay, do you want me to do updates first?
Why don't we go ahead and do your resolutions?
Okay.
Which are 1, 2, and 3.
Correct. So our first resolution is our request to fill our public health sanitarian position due to a resignation. We have an employee who's been with us a couple of years, who's moving out of state. And we would like to fill that position. We do have it budgeted. It will be slightly less than the budgeted amount, but not tremendously so, since she was only in the role for a couple of years.
Do I have a motion to
Move
put
it.
HH1 on the table?
Second.
Thank you. Any questions, concerns about this bill?
This is a recent vacancy.
It will be vacant on the
Oh,
14th.
it hasn't even become.
Yeah, it shall be, and the good news is there is a list that we can work from and we want to.
Great. That is good news.
Yeah.
Okay, hearing no further discussion, all in favor? Any opposed? Passes. HH2, but 2,
Our HH2 is a request to enter into and accept the funding through the public health preparedness contract with Health Research. It's they're an arm of the New York State Department of Health to help manage grants. This is a grant that we've had since 2002 to respond, create plans, respond to events, things like that.
may I have a motion to put HH2 on the table?
Make a motion.
I'll second.
Okay, thank you. Questions, discussion regarding the New York State Department of Health Public Health Preparedness Contract? And the
It's the
acceptance
same
of
amount as
this.
last year.
It is.
It's an
the same
annual,
amount
it's an
as last
annual
year.
award.
Probably about 5 years ago, they adjusted a little bit. We have asked for more, but it's federal funding that comes to the state through us, so it's capped right now.
Hearing no further discussion or questions, all in favor?
Aye.
Any opposed? Carried, thank you. And HH3,
Right. HH3 is a request to accept the next round of septic system replacement funding in the amount of $200,000. This is the I think 4th year that we've had it. I believe it's each round, and we did over 23 septic systems. We're able to take advantage of this in 2023. So far, we've had 6 people complete thus far this year and more in the queue.
motion to, thank you.
Second.
How do you determine, do people apply through the program? Was it
Correct.
identified through people that are not in compliance to reach out to? How do you determine?
So
The
that's a great
process.
question. So we've been trying to get the word out, but there's an application process. We can say, yes, you mean, you don't, there's no income eligibility for it. There's geographic eligibility. You have to live around Owasco, Cayuga, Skaneateles, and Cayuga County, Lake Como, because they're sources of drinking water. So they're considered the areas that are desired to focus on with the limited amount of funding that we have. And the state makes that determination. A few years ago, we were able to add Lake Como that had not been on the initial round of funding. Fill out the application gets accepted, we review it. It's really to make sure that they are geographically eligible. Then the next step is on the property owner. They have to get a plan from an engineer, and then we have to approve that. Then the installation can take place and they get funding up to $10,000 or half of the amount of the replacement or repair. It could be a repair also.
So up to 10,000,
Correct.
but no more than half of the actual repair.
Correct.
What tends to be the cost of, being a city legislator, I have city water, what tends to be the cost of replacing a septic system?
Thousands. So if you were starting.
Well above that.
Probably
It could be
25,000.
$10,000 to $15,000, depending on whether you have a traditional or raised bed system. Raised beds are very expensive. They could be 20,000 plus, so it really varies upon basically a perk test.
That's your tank.
Any other discussion, questions?
This is
Hearing none, all in favor of HH3,
Aye.
any opposed? It carries, thank you. So we'll go to your updates.
Great. I won't review, I know I wrote down a number of things. I'll just highlight a couple things that are on there and then a few other items. I want to say thank you to our county buildings and grounds in the city of Auburn. We wanted to kind of beautify our building a little bit, so we have some of the city flower pots over there now, and buildings helped get us a few more, so it's a more pleasant place for employees to go out and sit by the picnic table in the parking lot. Health education, Deb Pickering, our Director of Health Ed and Public Information, and Monica Salvage, who works at Mental Health as Project Director, spoke yesterday at the statewide harm reduction conference. I think you certainly got some aspects of it when Monica presents, but it's more to their presentation. I saw the slideshow. I haven't seen the presentation. I think we're going to try to bring it to the Board of Health. It was really, really powerful, very, very interesting. I'm glad they got to share that information about all the best practices done in our community. Healthy Neighborhoods, for your information, that's the home visitation, injury prevention, air quality program. Still serves the places, Port Byron, Metz, Montezuma, Auburn, but they're focusing right now and canvassing in the east end of the city of Auburn. In case you hear of that, it's real. We encourage people, if they have a question about people hanging a tag or knocking on the door, to call the health department or check with their legislators. So if you hear anything. There's I'll just pass this information around. There's information, we had an ISACHO grant to accept money for tick prevention, tick bite prevention and other things. They created this brochure. We also have a flyer for our latest early intervention night with play space. We have some guidance. We're going to be putting this up on our own website. As we know, heat is an issue, climate change is an issue, which contributes to, an increase in tick-borne diseases. I think at the Board of Health, Dr. Archer mentioned how, and I won't do it justice right now because I didn't write it down. 4 diagnosed cases of a particular type of tick-borne disease. It wasn't Lyme disease. I can't recall. Which is an unusually high number for us for June, and it's unusual in general. So it's important to be aware, as Dr. Joya was sharing with us all, Lyme disease, they try to estimate how long has that tick been on your body to help estimate your risk, but there are other diseases that are transmitted that don't take much time at all. So you really should follow up with healthcare if you find and identify a tick on your body. But there's also guides that CDC has out that I think Riley is probably familiar with also, that talks about heat risks and air quality indexes. So we'll share some of this information out on our website as well. I've had some conversation with Heidi about our lead registry program. We'll be having more discussion. We're going to try to talk with personnel committee. There is a requirement that we hire people to manage this project. It's a huge project. But fortunately, we have the funding to cover them 100%. So there will be more to come. You might be aware in July, the past few years, WSTN Channel 3 has done Your Town segments. They're coming back to Cayuga County again. We're going to have some lead prevention and WIC advertisement on those that we're paying through some of our grant funding. And then one area that Brenda and I had spoken about a little bit are the concerns about home care agencies within our community that serve our community. Rochester Regional Home Care is a certified home health agency, which is withdrawn from Cayuga County. If they are the latest iteration of what once had been the Cayuga County Home Care Agency, that's how we were kind of aware and engaged a little bit more, because we still had relationships with people who work there. But also we've had a number of calls from the community. It's becoming more and more challenging to find home care. And this is the home care that is, I just had surgery, I need a nurse to take a look at my incision type thing. And the reason Rochester had to pull out, one of the reasons that they identified was difficulty in finding and hiring nursing staff. We do know that Centerwell Home Health, and Essentia Health, and Home Care of Rochester still serve Cayuga County. I think there are some Cortland County who may serve southern area of the county. But there aren't a lot more options when it comes to the CHAs, as they're called, the certified. There are licensed home care agencies. They have different regulations on the type of work that they perform and the orders that they perform under. So I guess this is really more of an awareness that those of you who are around here and have needed home care in one aspect or another are certainly already aware, but it's difficult.
And this will prevent people from getting Medicare covered home care.
Correct.
Physical therapy, occupational nursing, not just custodial care or aid
Correct.
service. This is where people can come in and have Medicare be their payer,
Mhm.
but they can't get any providers.
Your mother breaks their hip, she needs home, she wants to get out of rehab and come home and have PT. This is who would serve her, and it's very challenging. And in fact, a number of people, that's why we were hearing about it. They've lost their service and they're not able to connect right now with another service, so that's a problem. So yes, it's more, there's no solution that we have at this moment, but it's for your awareness. That's all I had.
I have a question. I noticed in your report that you did lead testing on our Head Start preschool children, assuming countywide, not just city. I mean,
Correct.
we have a great amount of Head Start in the city. Are the results back in yet?
Yes, so you get the results at that point in
Oh,
time,
right. there.
because what we do is a finger stick.
Okay.
And then develop it, right? It takes just a few minutes.
Right,
And during that few minutes, we're able to provide education if the parent is accompanying. In this case, a lot of times the parents gave permission that we could do it.
what did the results look like?
And that's
What's
a
the
fine idea. I
comparable?
don't have that information with me.
Okay,
But we have, I remember last year, not even last year, I think it was in January, we did quite a few with them. And we probably caught 9 elevated.
Mhm.
Not tremendously,
Mhm.
but if they are elevated, then they're connected. We share the information with their physician, and the physician tries to order a venipuncture blood
Mhm.
test, which is that much more precise. So then you can identify whether they would get a home service visit
Right.
from our agency or not.
Okay, thank you.
But I'll find out and
Yeah,
let you know.
I'd be interested in the comparables and what has happened. Thank you. Okay, Christine, who is sweating back there, are you in a hot spot? We will let you, first go to resolutions and then you can give us your update. So we're looking at HH 4, 5, 6, and 7.
So HH4 is a resolution to accept funding from the ACL. It's a grant program that we have received funding from before. It was in response to COVID. We've had some allocations along the way for the last few years of 29,000, 16,000. What they did was, some of the counties did not use their full allocation, and they sent out an email to counties asking if we could utilize more money, and we've actually been doing a great job with spending our money that we received in the other allocations, and I wrote to them and said that, yes, I would like to have an additional $20,000. They approved that request, and this is a resolution to pull in that money so that we can continue to use it. We've been doing some creative things with it for our adult services population, folks, in order to keep people at home. We've done some home repairs for some folks. We've actually been able to pay for some back rent if someone was having trouble with paying rent so that they were able to stay in their home. Just it's kind of, up to us how we want to utilize it, and we've been spending it along the way. We've had a few larger chunks of money that we spent, a few $1,000s, all the way down to like if somebody just needs $50 to, buy something to make their house more secure for them, or to get them a bar for the shower, things like that. So it's been very nice to be able to have that money. So we're
Good
asking,
to hear that.
so we're just asking for that resolution. On that.
So HH 4, any motions?
Move it.
Thank you.
Second.
Any discussion or questions? Hearing none. All in favor?
Aye.
Any opposed? Moved. Okay, thank you. HH5,
We hold.
we pulled, that's correct, thank you for the reminder.
H5 is called. That brings us to HH6, which is a resolution asking for permission to fill vacant caseworker position in adult protective services. We had a caseworker who resigned to go work for the state. And we're asking to fill that budgeted position.
Okay, so, thank you.
Second.
Any, did we get a second?
I did.
Okay, thank you. Any questions, discussion? Traditional fill? All right, all in favor of HH6? Any opposed? Okay. HH7,
HH7
Similar.
is a resolution to fill a senior caseworker position, also happens to be in the adult protective services unit. We have a worker who resigned to go work for the health department. Health department. It's a budgeted position. Resignation. Recent. Yes.
Move it.
thank you. Any questions or discussion about HH7?
Oh, that's why I'm sitting between you two.
Question from Ben, thank you.
So are there people in the pipeline to fill these positions? Are you just hoping that we get some?
Well, the senior would be would be a promotion for someone. So yes, there'll be people in the pipeline that will fill that. The caseworker positions, we've been interviewing, and hiring right along, so it would be someone new, just it's hurtful to us because we have to train them from scratch, get people up to speed.
So there's actually a list of people that are available for that, or?
So the caseworker position that we do continuous recruitment, if anybody's interested in applying to be a caseworker, they can go into civil service and be scheduled within about a week. And then there is a running list, so when we have a vacancy and we're looking to interview for those, we get updated lists from civil service as they come. We had a pretty good pool of people for a while, and most recently that's slipped back down. But we've as we've been, it's kind of a constant.
The question, there must be something in the health department that's a higher grade than caseworkers, and it's like the interest of staff moving over, is it? Or,
Not necessarily higher grade.
it's just different work?
Yep.
Are these early interventions?
I can say this is the third staff member we brought over from social services.
To do early
In early
intervention, work?
intervention service coordination.
And that is in a higher grade, or maybe
It's
one higher?
it's not.
It's not, it has not always been an increase in salary. as the reason.
Okay.
It's a challenging job that they do.
It's a senior caseworker going to take
Early intervention
really
services.
services coordinator job.
So that, in that case, it wouldn't be.
You're gonna be filling the senior position with internally, correct? Which is why it's the out there. They're all- so you-
Behind, yes, so we'll be pulling as a caseworker, and then having to fill that another caseworker position, so another person needs to be trained from scratch. This situation sort of illustrates the concerns that I've had with salary for the caseworkers, when we're losing staff to other departments. That I have said, the jobs that we have are tough, the work that we do is tough, and some of these jobs are appealing, because they come with different. Job requirements and the things that they're required to do, not that they're not hard, they're different. And I think that, it's gonna continue to happen, I believe. And, I've had discussions, we've talked, about our concerns for the salary. For our caseworker, senior caseworker, supervisory staff. This is two, one to the state and one to, in another county department, so. With these two, I don't know off the top of my head. We start with you, it's right, John.
More than two, right?
Yeah, more than two.
I can say that we'll be fully staffed in EI. If that's any consolation. It's not. Yeah, I know.
It's not for Christina.
Yeah, no, it's not.
It's been a long time since you've
It's
been
been a
fully
long
staffed
time
in
since we've been fully
early
staffed.
intervention though. too.
Yes.
Yeah.
I'm hoping no time soon will there be further interest for your staff to come to our.
Okay, any other discussion, questions? And I did get a motion, just to remind me, because of the thoroughness of this discussion, we did get a motion and a second on the table, thank you. Okay, any others? All right, hearing none, all in favor?
I,
Any opposed? This is carried. Okay.
So I didn't, do you want me to stop for a minute?
Yeah, so I wondered if you could go
Yeah,
through
so
a report for us.
actually did not submit a written update. We were in the middle of, managing the closure of the building and staff needs and, you know, trying to make sure that we're serving the public the way we should, so I apologize for that. I guess that's my biggest update, is that we're trying to get everything in order to best meet the needs of, you know, the clients that we serve and also our employees. Thank you to everyone that's here that's offered help and support. We have had, you know, tons of reach out from other department heads to offer space for staff to come and sit. We're working through that, and we actually do have staff stationed in a number of county departments, and that's been very helpful. We continue to have, I guess our largest issue is, you know, not being able to have access to the things that are in the building and not having computers and things for everyone, because our department is definitely not 100% remote capable. And that makes this very challenging to manage. So working through it, trying to keep everyone feeling we got this under control. We are serving the members that need to, of the public that need to see us in person over at the 10 Court Street site with the historians. We've got staff over there, regular business hours, 8 o'clock to 5 o'clock, Monday through Friday. We're there. We have our technology there that we need. So business as usual as far as that goes, just in a different location.
What are those hours? The regular?
8 to 5.
8 to 5?
Yep, we've got security there, we have staff stationed there, we have supervisors checking in. We're utilizing other sites for some things that we need, as far as like printing capability, just trying to patch things together to do, a scaled down version of DSS operations.
Mhm.
And trying to work through ramping that up. And that's our goal, is to be thoughtful about what we need and ramp that up so that we have, everyone back doing what they need to do and having what they need to do it. So it's,
Here's a question about a typical example that member of the public or client might have. Someone who needs to recertify or has already had their appointment to recertify. Can they expect that they can make a phone call and do that and?
so on the website and on social media and in the paper has been the number to contact
Perfect.
DSS, 255-6272 number. It's running through our answering service that we utilize. And the answering service is taking those calls in, screening them a little bit around what the need is, and then sending them off to supervisory staff that are ready to take those phone calls. And then it's really like individual based. So based on who's calling in and what they need, we're meeting their needs by saying, okay, come on into the 10 Court Street, or we can help you over the phone. You're gonna talk with your examiner. You know, we are in a position still after COVID where we can do more virtually with clients than pre-COVID. So that's a good thing. We can do recertification by and large over the phone. We still do need to have in-person capability. That's, you know, we have not been relieved of that.
Because unlike COVID, there's no waiver.
There's no
of the
hybrid.
face.
No, so
Right.
they're expecting that we're going to be able to meet the needs of all of our programs, you know, in the way that we're regulated to do so. So we're trying to work all of that through, but luckily, I mean, we are still able to do quite a bit, because they changed the regulations for some of those things after COVID,
Mhm.
because they saw that it was actually helpful for a lot of clients to be able to not have to drive a car 45 minutes, you know, from Sterling or down south
Mhm.
to meet with their examiner. So we're allowed to do that work over the phone,
Mhm.
and we're doing that, and we have been doing that. In person, you know, we needed to get that up and running at a different location, so we've done that, but that number is really still what we're using to streamline everyone to us, and then
Okay.
figuring out what to do from there. You know, workers are getting phone calls still from clients through their computers. And
Right.
if the worker doesn't have a computer, then that's the challenge, is that their clients aren't able to reach workers that don't have a laptop that they're working off of. So that's why that number is important, that 255-6272, and that it's out there and published. Because that's how people are finding their way to us that are not getting a call back from their workers, say in a day. they're calling that number,
255-2672-62.
255-6272.
I only ask because I think, as a legislator, often, my own social media page gets read a lot. And I've noticed all kinds of things on social media about people saying, oh, no, I won't be able to be recertified. I won't be able to,
Yep.
and they're just talking amongst each
Yep.
other. And they need to get this number where they'll get, they'll get the information and be flowed to the right place.
We still need to be able to take child support. People come in with cash to pay us for child support payments. We do accounting transactions for people to pay their Medicaid spend downs. All of that can still be done. So we want to make sure that people know that that can still be done and, right now. Kind of work. As we work towards, looking at this being a little bit more long-term, that potentially may change, but right now, 10 Court Street. And utilizing that number.
Thank you, thank you. And thank you for, I know it's been especially difficult for you, for your department. How many are without computers, are working remotely but didn't take their computers?
I don't have the exact number. We're surveying staff right now because, what happened is even if some folks had laptops available to them, they're marooned in the building. And we can't access them right now. So we're trying to get, I put out a survey to all the supervisory staff that I need a breakdown of who has, remote capability. Do they have that with them? And what do they need? Do people have connectivity issues at home that have the ability to work from home? So we're getting that information coming in.
Okay.
And I'm reporting out to the leadership team. But we do have, our services section is pretty much remote capable, 100%. So they're with a few exceptions, they're working right along. So they probably, out of all of them, were able to kind of smoothly go into the practice of continuing to do their work out of all of the sections of DSS. It's definitely temporary assistance. It's a little more challenging, but we're working through it, and staff have been great, flexible. Like I said, we're receiving tremendous support from other folks in the county, so I appreciate that.
Thank you. Thank you. Any other updates? Thank you. So we have Deborah.
Hi.
Who does have resolutions tonight?
I'm hiding down there.
Oh, yeah, I've been looking for you. So Deborah, why don't we go through your resolutions, which will probably be part of the updates?
So I have 4 resolutions this month, and they're all related to ARPA funding. Our youth advisory board met and we discussed these last 4 proposed contracts in detail, and actually 3 of the 4 joined us for a Zoom meeting to present some of their programming as well as answer questions from the board. And one of the resolutions had a day-long program held at Bosse's that myself and another member of the board attended. So they're all related to ARPA funding. The first one is authorizing the chair of the county legislator and the youth bureau to enter into a contract with CNY Sports Management Group using ARPA funding. That is for $25,000 broken up over 2 years. So $12,500 for 2024 and the same amount for 2025. This is funding a youth flag football team as well as a youth basketball program.
And if there's no opposition, what I'd like to do is wait and bundle all of these because
Okay.
of the similarity of intent.
Okay. The second one is to enter into agreement with the Seymour Public Library District using ARPA funds for specifically a new program that they're looking to pilot, specifically for teens. So it is for $18,727, and this is for a teen program. The third one is authorizing us to enter into a contract with Southern Cayuga Future Farmers of America for their Growing Hope program using ARPA funds, and that is for $25,000. And the fourth and final one for ARPA funding is entering into a contract with a Hideout Gaming Center using ARPA funds. the board had met and we did reduce, the ask of their funding at the time. So we have reduced their amount. And they are now at $56,991. That would be broken up over 2 years as well. Breaking it up over the 2 years also gives us an opportunity, because it is our new program, to visit them to see if we wanted to continue with the funding for the second year, making sure that the program is successful. And we're monitoring that, making sure that they're doing what they had intended to do with the program.
And that has been effective, actually. We've actually, brought back funding in that was promised because of closure of the program that we had funded. So I would like a motion to bundle.
Bundle.
Thank you.
Second.
Any questions, discussions?
What's your meeting now? I know we asked you that pretty much.
This would actually take care of the entire ARPA.
We're done with our.
ARPA funding. Now, the funding had to be, contracted by the end of 2024 and spent by 2026. So these 4 resolutions would take care of that.
The gaming center, I think.
It's been open. They're in the process of moving to the Eastville Medical Center, which is a great, in that building where there was a underground cafe.
Where the hideout gaming center is.
It's actually an East Hill building, so it's right on the corner of Genesee and
In Westlake, Williams.
Yep. And so they do, just different, it's kind of like you can go there and they have games that are free, like in hard style games that are free, or you can purchase like a pass to use a lot of like the newer gaming, the VR equipment, things I'm not that familiar with, like VR, Xbox, things like that. And they have holiday parties, they have really interesting programs where they, if kids bring in their report cards and good grades, they can earn credits to be able to go for free. And Heidi had a wonderful suggestion with the board that a portion of the funding is going to be set aside for scholarships for the youth to make sure no one is turned away from ability to pay.
One of the other things I want to ask you, which is actually Eastville Medical is going to be partnering with us, so that if clients come in and they have kids that are with them that need to come to appointments, the kids can go down to the hideout while the parents are, at doctor's appointments.
Right, at no cost.
Partnership,
Right.
at no cost.
The hideout also, they do some collaborative programming with youth at risk from Cayuga Counseling Services and collaborative programming that's pro-social recreational with Booker T. Washington youth. So they have really made some deep networking in the community, and they have shown self-sufficiency. I think one of the things that I'll just say as a member of the advisory board committee, it was important. There are 2 things that seemed important to us as a group. Number one, that we serve the whole county, that we really looked at programs from north to south. And we were fortunate enough to get applications that allowed us the ability to make those decisions to look at applications from north to south. And we looked at sustainability. So this wasn't just a chunk of money that goes out to groups and, oh, you've had a great year, there you go. So we really looked at sustainability planning and looked at that as one of the pieces of our decision making, because we couldn't fund them all. There were plenty where it was a no-go. I would say quite confidently that all of these programs have great sustainability planning. And so this is a nice slush to add either new things to a community, or to add contemporary pieces, updated pieces to programs that are resurging or needed a shot in the arm to resurge. So the money well spent, and I think I'll be happy to eat my words if a number of these programs fall and fail to blossom and continue to bloom as a result of this money. So it really met the intent that was made with the original resolution, which was to support and develop programs. And that development was, that resolution talked about sustainability. So job well done.
Thanks to
Thank
the committee too, you've been really helpful. And I think that that's important, having the sustainability and talking about site visits and monitoring and getting updates. That way I can keep all of you informed as well of how the program is doing. Then I guess going into some of my updates, this
I
is
think we
kind
need to vote on
of.
this.
Oh, I'm sorry, we didn't do that.
Any other discussion? Questions? Okay, hearing none. All in favor of the bundle of HH 9, 10, 11, and 12?
Aye.
And any opposed? So carried, thank you. Sorry about that interruption, we'll let you.
This time of year, we're kind of, with the Youth Bureau funding, whether it be ARPA or OCFS, kind of wrapped up finalizing the funding request for 2024. Getting the contracts going for a lot of these programs that are getting ready to really gear up this summer, as well as starting to do reimbursements for some of the programs that actually did start back in October. And then also, my next New York State OCFS meeting, where I'm hoping to get an update on our 2025 allocation, is June 17th. Last year, they were late in getting us our allocation. It wasn't until August, so we weren't able to send the request for applications out until then. And my goal and the boards as well, we would like to get all these applications out a lot sooner than we've been able to, because the state did change their program year. It's not a calendar year like we've typically worked off of here with the Youth Bureau. So they're doing all their funding from October 1st till September 30th. So this year we didn't, I mean, we're still finalizing, in the spring, we were finalizing some of our OCFS funding. So they're just able to backdate some of those expenses. We liked having the opportunity for people to come in and answer questions and present. So I think that's a format that we're going to continue with. Everybody really liked that, having that open door where we could really get a sense of what these groups were wanting to do rather than just see what they put on paper. So once I get that allocation going, our board will meet, kind of come up with a plan for our application plan for 2025. And hopefully that's sooner than later in this season rather than how it was last year. And that's really all I have right now. Just like I said, getting ready to start doing a lot of those. What I typically do is a site visit, where I just kind of pop into the programs, announce, unannounce, just kind of make sure they're doing what they say they'll do, ask some questions, observe. I do have an evaluation sheet that a lot of times I'll work with the program director for them to self-evaluate, just to see how they think the program's going based on the goals and objectives they initially laid out for themselves and how their attendance is and etc.
Thank you. Motion to adjourn.
Make a motion?
Second.
Oh, did you have a question or comment? Oh. Okay, all in favor? And that carries. Thank you. Thank you to all our department heads, legislators.
5 p.m. No worries. What's that? Okay. All right, we're gonna call the meeting to order. Legislator Daley,
Yes.
DeVito,
Yeah.
Shay. Here. Winslow. Here. All right. And I'm here, so. We're gonna start with the minutes to approve for May 1st. Can I get a motion?
Second.
All in favor?
Aye.
Okay. We don't have any appointments. We're gonna start with Tyrone. Tyrone.
I don't have any resolutions, just a couple updates, we were able to hire an account clerk. Something that's been vacant for us since February. So hopefully we'll be, should be starting in June 24th. Got our 5 officers back to training, so that's been helpful, just with getting things caught up. I think you saw the new numbers for us. We're probably closer to about 700 now supervision cases. And the investigations are staying pretty steady. It's been able to help us out with that, and the judges to kind of keep the number at least around that 60, 65 area. Working on the annual plan. It'll be the first one I've done, so I've been reaching out to different directors about trying to figure out what exactly we need to do, and I think it also, I'll have to reach out to Lynn with some things about the state aid. Because I think our ATI grants attached to it, and then we're also working on the ATI grant, which is also due about the same time. So working on those, that should pretty much take up the month of June to get these completed. And I just put in about these vests here. We're in need of some new vests, like for the new officers, and we also have like, I think 3 of them are just expired in our office. Talked to the sheriff, and got me in touch with the person handling the PVP grant for them, and so we're all set with that. It's just more that this is gonna cost about $8,000 to get a vest for the number that we need. So we get about 4,000 back through the grant. I guess I'm just sitting on this a little bit until I kind of want to see what we have left towards the end to see where we might be able to move some funds around. See what we got to throw into that mix, but it's something that definitely need to address at some point.
And does each PO have their own vest?
Yes.
Okay.
Say they're expiring or coming out of.
They're about
They have
5
a
years.
shelf life.
Yeah, about 5 years.
Yeah.
I guess by sitting on it, there's a chance in putting anybody in danger of.
Well, I mean, it's 5 years, like you give it a little bit.
I wore one once that was 10 years old,
Yeah.
before the county replaced me back in the day. Not Cayuga, but.
I'm pretty sure my first one was probably about
Anybody shoot at you?
about 6 years, 6 years back.
Just look out for the safety of our people.
Yeah, no,
And liability.
I wouldn't put anybody, I would go get these if, or figure out some way to get it, but I'm not saying kick it down the road like a year. I'm just saying kick it down the road a couple months so we can see what
You've got time to get a handle on it.
right, then a couple of these don't expire, and some of the people that retired, we have their vests that we're kind of filtering through right now. So we'll be okay until you'll know exactly when we need it. I'll be coming back.
All right.
It's nice to have everybody have their own, they're fitted to them and it
Yeah.
fits them specifically, so that's important, and it's important to keep it in that time frame. So, yeah.
And I
we'll talk
think
about
it's
it further.
smart when you're meeting with Lynn about the ATI grant, that basically you talk about any budgeted line items and where they're standing, maybe there is some room to move and do it sooner than later.
What's the number of, future expirations on some of these vests? Is this something you have a couple more next year, or? I mean, I know.
I would say that this was planned poorly, to say the least, but the thing is that I looked at everybody's right now, it was like when we had the guy come fit. The officers that we needed, that's fine, so everybody's good for a couple years, except for those 3 that are just expired.
I mean,
Or it's going to be expired,
this would be an item you would probably kind of slip into the budget
correct,
to be
yeah,
prepared for, so you're there.
yeah,
Harold, any potential that TIF money could be used for this?
no,
Oh, there isn't.
not at least. Not in the current, not in anything current.
Any other questions? Anything else? All right, well, thank you very much.
Thanks.
All right. Is Dr. Adam Duckett here? All right, we'll move on. Zane, you wanna come up and present? Over there, right there you are. All right, go ahead, Zane.
What do you wanna know? Anybody got any questions? Okay, I don't have a lot to report because last time I was, attending the meeting, I pretty much told you what I do as other county coordinators do throughout the state. And I told you that I lean on doing PR work a lot. I'm getting a very strong vibe from our newest Auburn Bagel Company owner, Tony Dadavo. He had some coffee sleeves created that had his name on it and Stop DWI logo branded, as you well know, Jonathan. And I hate to use the word, but he used it. He said, people are raving about these coffee sleeves. They're mentioning them. That's a big thing. That in itself is public relations. Ordered some Stop DWI t-shirts. This is what they look like. They're very good quality. Something like this, different sizes, even including the youth sizes. And the focus was to use these down to the, primarily down to the Doubleday ballpark. Because they have a shirt shotgun and they fold these shirts up and then they shoot them into the crowd at certain times during the games, and they mostly use them when the college teams were playing down there. Related to baseball, I would like to mention this. I really think the city, using a term, dropped the ball on this tournament because we just had, for the first time ever, Division III World Series down there. And I felt like I didn't hear it from anybody, any reaction, any type of comments made, positive or negative, just that the crowds were very, very minimal. And, we just sent them Doubleday's operation, $3,000, and they display our Stop DWI logos throughout the stadium, the field. And they also advertise this every once in a while. I don't know how many minutes in between or how intermittently they do this, but they'll have a Stop DWI commercial over the loudspeaker. So, and then we have law enforcement folks come down and we all try to get the different branches, the sheriff, city and the state troopers will show up, and we set up a table inside the gates. And we give out branded items to the people that come in, and if the kids got questions, you got these handsome men that are all armed up and they're ready to answer the kids or just recruit for the future. It's just a nice experience. What else is new that I can mention?
How often are you doing those events up at the ballpark?
Pardon me?
How often are you getting the deputies and troopers and stuff up the ballpark?
We do it once for kids' night that I know, coordinate that with Brian and Jimmy Slayton and Officer Russell, troopers. Would you like to see it more, or has anybody got any
I don't know
recommendations?
what normally is done,
Yeah.
I was just asking, so.
I know we have new signage, went directly behind home plate. Traditionally, it's been called the Bull in any stadium. And they put up new signs, advertising stop DWI branding, which is a good thing. And then, of course, we got them on the fence outside, out in the outfield. So that's been happening.
Any questions, concerns? Well, thank you very much for the update. Who else doesn't kind of- Lloyd, go ahead, sir.
Thank you. I do not have any resolutions. You all received my report. There's really not too much of an update. I will share one concern. I know last month Lynn and Grace had done a presentation to Ways and Means in regards to the projected 2024 budget, and I know that the sign council was red flagged in terms of issues coming up, maybe in the next couple months with the budget. And I think they're right on target. I'm a little apprehensive with our budget in that we're 5 months into the year and we've expended over half of our budget, so
It'll be short.
there's concern, and I think Lynn and Grace were right on the money when they said we probably should pay attention to it, so and we'll see how the rest of this month comes in, but you know, my fear is that we'll be back here in November with no money, so.
I just had one question, and not a lengthy description, but the issues concerning the centralized arraignment program. We've met because, and I remember you and I talked that there's a judge in the morning and then there's one that comes
Right.
back in the afternoon or 7 o'clock at night, and the sheriff has custody of people in between, but it's something about the way the program is running.
No, I think it was kind of a more of an update. We really hadn't gotten together as a group to talk about CAP. It's 3.5 years old now. And we had some little issues to resolve on appearance tickets, on bench warrants and arrest warrants. And pretty much left all on the same page. So it was kind of a.
Just to get together, not that there were these plaguing
Exactly.
issues that.
Exactly.
Okay.
Exactly. Yep.
Any other questions?
That's all I have, Jonathan.
All right,
Thank
very
you.
much, yeah. Awesome. Riley.
I have no resolutions this month, just a couple of brief highlights. One is we're gonna be planning for that fun swear word of Aileen's fireworks. That great event that'll be just around the corner very soon. That's in process, and I just want to draw particular attention as we're getting trainings and other things done. The season is already open for business. We had a successful rope rescue in Fillmore Glen over Memorial Day weekend where we had our rope team. And we had 15 volunteers as well as 2 deputy coordinators and myself on that scene as well. And we had a woman take a pretty good tumble and end up with probably a broken shoulder, broken wrist, and a head wound as well. And so we got her up and out of Fillmore Glen on the gorge trail. So we're open for the season and we're doing well with it. And beyond that, if anybody's got any questions, that's what I'm here for.
So you got questions for Riley?
How's the other lady doing?
We didn't hear a follow-up after that. We were fortunate. We had a paramedic with 4-town ambulance right there. They had another call going on at the same time, but we didn't have to airlift her based on presenting symptoms, but she's gonna be a hurting unit and probably in a cast for the rest of the summer. We'll put it that way. She's an out-of-towner. I forget what county she was from. She was just visiting for Memorial Day weekend.
Riley, you're still waiting on quotes still for the
Correct.
striping the light?
Correct. I have a follow-up meeting with a vendor tomorrow.
Any other questions? All right, thank you, Riley.
Works. Thank you.
All right. Denise isn't here, so I'll step right out. Come on. Come on.
Oh, good, we were wondering who you were.
I'm Don, who's left for anyone who hasn't met me. We have, 911's got 3 resolutions this month. The first is to sign an agreement with Motorola, migrate our GIS data and, convert it, the new data set to the server. It's an essential update to keep everything current. It's in the budget. And we need to get on the schedule now, even though the process isn't probably gonna happen until the end of the year, because they won't put us on the schedule without a,
Yeah, I spoke with Denise on the phone and we need to pass the resolution prior to the scheduling of the work, so it's just a procedure. What's the second one you have? Frank?
Second one is to fill a ESD, emergency services dispatcher position. Due to an unexpected loss, we lost somebody in April, passed away. So we're just looking for authorization to fill that spot.
All right, and then the HVAC and.
Yes, she was able to find a vendor that's actually significantly less expensive than the previous vendor to do the HVAC at all the tower sites.
Yeah, it's about half the price, right?
I think that's what she said. Yeah, she said it was significant.
It's about a half of, we're saving, it's the contract renewals amount is about $4,500, and I was advised by Denise it's about half of what it was the previous year.
Is this an RFP or she just found a new vendor
I don't know the answer to that.
I'm not sure about that either.
Before I present as a bundle, would anyone like anything separated individually from the committee? All right, so I'm gonna propose we have bundle JP 1, 2, and 3. So bundle, I get one move it.
Motion.
Second.
Yep.
Second, thank you. Any discussion on any of the JP 1, 2, or 3?
Just quickly, the Spillman, this came up when we were talking about IT and it has to do with the CAV, which I really didn't know what the CAV was.
You can, yeah.
And that has to do with communications for critical services. I mean, what?
Yes, this is the GIS, they call the mapping and
Uh-huh.
the address verification, and that kind of stuff. And this is gonna be a significant update that's gonna make the system work a lot smoother.
Okay. Thank you.
Any other questions? All right. All in favor of the bundle?
Aye.
Any opposed? So moved. Anything else, Jen?
Just a couple quick updates. We currently have 2 vacancies, obviously the one that I just mentioned, and we have one other one. We're just waiting for certification of the new list, and then we'll start the process of looking to fill those. Denise also just wanted me to pass along the new grants that were released, PSAP and SICG. They were due June 12th. She's already got it submitted, was submitted on the 20th.
And just for myself and the rest of the committee, what are those grants pertaining to?
I don't know all the specifics of it. I know some of it could be for things like furniture and upgrading our chairs. I don't know exactly what's in store for them, but it's something that she does apply for on a pretty regular basis.
Any other questions for Ben? All right, thank you.
Sure.
Good to meet you.
Nice to meet you.
All right, next up is the district attorney.
I have 2 quick updates. We did have a guilty verdict last month, for sex abuse first and attempted rape first, so that was a good conviction. Sentencing is gonna be set in August, for that individual. We also have one of our prosecutors has, been assigned to act as special prosecutor up in Oswego County, so this week he is currently in the middle of a homicide trial. So, we are helping that county out by doing that. I have 2 resolutions on. The first one is fairly straightforward, is to accept the funding for the Crimes Against Revenue Program, grant award. In full transparency, I want to, from now on for grant funding, I'm going to be very clear as to where that grant funding is going. So this grant funding has for years since, the inception has been going to offset the salary for an assistant DA, for, our grant coordinator, and as well as an investigator. So portions of that grant is being split 3 ways, to those 3 positions.
And something I'd like to set up, you and Lynn have a sit.
That would be great. Yes.
This is right now just in a revenue account and the
Correct.
expenses are there, but
Correct, and I want to be a little bit more specific about where the grant funding is going, because there is a county in the state that's getting audited for it just going into the revenue account, so I want to make sure that we're proactive before budget season and kind of get that all situated. Sure, it's being, it's not being split evenly, but it's being split between an assistant DA, our grant coordinator, and then an investigator.
Thank you.
And that's been how you've used it for years.
Forever since that we first got the grant. So we went back and looked at the original resolution and what that was, what those funds were allocated toward.
I get a motion for,
I'll move it.
for,
A second?
any discussion, further discussion?
Second.
All in favor? No opposed, so moved.
My second resolution is to create and fill a full-time senior grand jury reporter within our office. We currently have one at a lower level. I brought this to the committee's attention last time. She did receive several offers, one from the state and then one from Oswego County that surpassed the salary she gets here, but I did work pretty close with Diane Ferris. I went with her recommendation as to grade level. I trust her judgment. She's very good at determining what's a comparable salary to other counties. So that is what I put in the resolution. I also, it would defund the current grand jury stenographer position. I would like to keep that in place because I can't guarantee that our stenographer is going to stay, but it does give us the flexibility down the road if she leaves, that I can hire someone brand new at a lower level or someone at that senior level. So it'll give us the possibility to recruit somebody.
Any motion, put this on the table.
I'll move it.
A second?
Let's have some discussion. Any questions?
So you're asking not to abolish the position,
Correct.
but there will be no funding in it because the funding you are going to use for this. And in addition, you have a transfer in that resolution to move money from a budget item into that line to try to increase that line as well.
Correct,
I
yes.
think 10,000, right?
Yeah.
Yes.
Okay.
We did have, I took a good look at our budget. We did have some money for contractual grand jury stenographer positions in the event that we didn't have our grand jury steno there, but if we have someone full-time, we'll just work around that. So there's really no need. There's about $5,000 in that position. And then I had to pull from our expert fund that we use for our expert witnesses and grand jury.
Try to get enough funds in there.
To try to get enough,
Do it.
exactly, and we very rarely use our expert funding. It usually just goes back to the county, so it's kind of just there as a buffer.
Mhm.
But we really do need, this is very important to our office, is keeping our grand jury stenographer.
And even though you're increasing the wages, you're able to keep it budget neutral, so there's no.
For this year.
Yes, yes,
Again, I've talked to Diane, we've talked, I do give you credit for being somewhat flexible. Your initial request to the county was extremely high.
Yes.
Because you didn't want this individual to leave, and I understand on some data that Jonathan got, that if this position left, we'd have to pay per diem. And the likelihood of getting a grand jury stenographer when you need them wasn't guaranteed.
yes,
So you settled on increasing the grade, giving a few more duties.
yes,
And from talking to Diane, the change from the grade they were at to the grade, this is 34, that seemed to be consistent with what other physicians had been doing.
correct,
And that it isn't the initial request you asked, but it's certainly a show for this individual that she'll be at a step and then the steps will increase.
yes.
And it's a way to get her to a more, what she feels is a more fair wage.
Yes, and
contained.
I think it's a good faith step toward that direction.
Yeah.
And I can't guarantee she'll stay, but I do think that it gives me a better conversation.
And no one likes to feel like they're handcuffed, that it's gotta be this way or not, but this was a fair compromise.
Yes, and this will make her, I apologize, this will make her comparable with the surrounding counties, the grand jury stenographers, where she was only making 60,000 for a long time, and that was about 15.
And then
15,
70,
20.
and now she'll go to 73,
Exactly.
6 or something.
Yes,
Yeah, you just touched upon what I was gonna say. I think that it makes us a little bit more competitive,
yes,
which with anything, we need to be within fair range of being competitive with other counties. And I think if I remember correctly, like Onondaga County, I mean, this puts us like maybe 8,000 above of what Onondaga County is.
Well, they're in the
They were about
60
60 to
range
80.
based upon, they're in a 60 to 80 range based
Okay,
upon
okay.
time on job.
So, I mean,
it puts us
coming in at
comparable,
73,
right,
it puts us in
yeah.
comparable
Correct.
measure, and it at least makes us competitive.
And when I met with Brittany, we talked about it, we talked about comparables, and I said, well, I always take the top in this case, Oswego County just throw it right out.
They were 91,000.
It's just not even. So this was I think this was a fair compromise. I think this is if the employees willing to stay, that this is a compromise on all parties. And it's fair, I agree.
I just have a question. So we have made this sort of strategy to keep this person. But the idea that we would continue to keep that original position, so the strategy was designed to keep this person there, that's being successful. Why would we keep the other position?
So when we talked about, and Diane, what was relayed back to me is that if the person decides not to stay,
Right.
then the district attorney can go out and hire somebody and say they're new and go back to the original position. We're not locking in this higher grade. So they would continue to be a grade 26 instead of the bump up of the grade 34.
Because she really is senior. She has a lot of more experience, than she even initially started with. So, I don't know if she leaves, I honestly, not just will contracting cost the county a lot more, but I don't think I'll be able to find somebody. Which is my concern, but if I do, they're probably gonna be brand new out of school, that person should not have the same, should not have the same grade as this current employee does.
I just feel like at this point, if for some reason she didn't stay, we'd be looking at a higher salary anyway. And I'm interested in those additional duties and whatever we would potentially put on her now, you would need those duties fulfilled. And you know what I mean?
That's true.
We got used to somebody doing additional duties. We didn't want to
Make sure the person that we,
assign them.
So the likelihood of us getting someone even entry level for a lower salary is not there.
Well, I
That's
just
true.
think if we create a position where they're more useful to you, why would we?
No, I mean.
I would be
that's-
backwards, right, I would just, that's, I'm not on.
No, I mean, that makes sense as well. The additional duties, which when we talked about, we upped her salary before. Which a new person would have to do too, would be local court trials, because we cannot get anybody to do local court trials, so that she has taken on that role as well.
Well,
You could amend the resolution.
I'm comfortable the way it is, and we could always amend it at Ways and Means, or we can amend it here. I'm not gonna propose an amendment. If someone from the committee would like to propose an amendment, then we could have discussion on that as well, so.
We'll leave it to Ways and Means and see what the appetite is in terms of abolishing the entry level.
I honestly, I see both sides.
How do you guys
I mean, I get, Aileen, what you're saying, but I also.
You're okay with as is for now? Okay.
I'll certainly remember it's unfunded.
And I don't have an opinion either way. I mean, I do think that that is a competitive salary at this point. I was looking at the stenographers in Onondaga County. There's one brand new girl who's like in the 60s. I think she's right out of school, and everybody else is toward the 80s because they've been there for many years.
I just think at this point, it's 2 years from now, then. We wouldn't be.
Yeah,
to go
I think
that's all.
I think it's a fair conversation to have, and I think, we have 2 weeks before Ways and Means.
I was gonna say, I myself, I'm comfortable moving it to Ways and Means, leaving it the way it is, but
Yeah.
have further discussion. at
Yeah,
Ways
and
and
I'm
Means
open,
to-
and I'm open to amending it as well. I think that's a conversation to have
Yeah.
further. I think it's not something I'd actually thought about, so thank you. All right. All in favor? Oh, I'm sorry, did I get a motion?
I'll move it.
All right, I need a second.
I think we
I
did.
did get a motion. Yeah, I'm sorry. All in favor?
Bye.
I just want to add one thing to the discussion,
Yes, ma'am.
if I could, just didn't get it
No,
in
it's
there
okay.
quickly enough. So clearly, when you're planning for 2025 budget, you've got about $10,000 that got to find and move around, and so that's probably on your mind now, you understand that.
Yes, I actually found the locations in our budget that I would pull from, and we put it in the resolution, the
The things that are
specific,
in the resolution.
exactly, the specific area.
Can go forward,
Yeah,
because I read it,
yes,
I just
yes.
read it thinking, this is a solution now, but it can.
But
be a
further,
solution
yes.
going- Okay.
Yeah, we do have some flexibility. Like I said, if we have a full-time stenographer, we really don't need that extra funding to contract with someone else. I mean, and she's very rarely, unless she's on vacation or ill, we very rarely have to pull someone in for grand jury. So,
And that's the account you took it from.
yes.
Yeah. think we all sympathize with the fact that these are hard to come by.
Yeah.
And that you would be in a very difficult
It's
position.
crazy. The problem is so many are retiring, so, it's just been.
Well, when there's strong competition out there and you have fewer people applying to those positions.
And for us, we have to have a stenographer. We can't do recording. We can't, we couldn't move forward with any prosecution of felonies if we didn't have one, so.
Anti-you.
Yeah.
I get it.
All right. Guess that's it. Thank you.
Thank you.
Good work on your guilty verdicts.
Oh, thank you.
Sheriff, you ready?
I am.
All right.
Good evening, everybody. The only additional update I have along with my report, I've been asked by a couple of you about the boat that we budgeted for. We did find one that's made by Metalcraft. It's designed for first responders. We checked with Amanda O'Grady just to make sure that we were able to procure it under the GSA contract that's listed on. She's confirmed that we can. I'm going to bring a resolution forward next month relative to that. And that's at a total cost of $125,600. We did budget the 100,000 plus the 100,000 match up to the 200,000 with the state match. But it looks like we'll be able to purchase that in total for 125,600. We'll have to seek reimbursement for half of that if that's approved. There'll be some small costs to upgrade that. Just getting the radio transferred over to it. Probably a few lights are going to need to be upgraded. But anything that we can transfer from one of the old boats, we will. But they're getting pretty tired, so I'm not sure exactly how much, but it's gonna be somewhere in that $130,000 range, probably by the time we transfer some equipment over and upgrade some lights. And I think in the budget, $100,000 up to was appropriated using ARPA funds, so if I remember right. Any questions on that?
Yeah, Sheriff, do you have just like a breakdown, like, for example, you mentioned like radios that need to be installed on the boat?
I have it.
You have that?
I can forward it to
Okay.
you.
I was just curious, like what the line itemization of, to get the boat fully, after you purchase it, how much does it cost to implement all those things that you need, lights, the radio system, whatever?
And I can bring that with me next month,
Okay.
Along with the resolution, so we know exactly what that
Okay,
will cost.
yeah, that'd be great.
I can do that.
Thank you.
I've been reaching out. I talked with Amanda down in purchasing
Okay.
and she provided me with the quotes and that information, so I'll
Okay.
forward it to you. I'll
Okay.
forward it to all the committee members.
And any of those additions would be eligible for that and split?
Correct.
Yes.
Thank you.
Thank you. I don't have anything else unless anybody has any questions.
No, I'd like to start this with JPA for the resolutions. JPA is regarding an agreement with Schuyler County for services. Sheriff, you want to elaborate, please?
Sure, this is basically a mutual aid agreement that we've entered into with Schuyler County numerous times. And that is for us to be able to provide mutual aid primarily when they have the big NASCAR race in Watkins Glen. We've sent folks down there, some of our people, to help them with that because it's such a large scale event a number of times over the years. We haven't since COVID. I think 2017 or 2018 was the last time that we did. However, we're just updating the mutual aid agreement so that we have the ability to do that in the future should we choose to do that. Schuyler County, I do have the agreement, as it's always been, reimburses us for all of the costs. Fuel, any damage to vehicles. They provide $30 a day for use of the car. They provide payment for wages. So they indemnify us. So everything's covered by Schuyler County, but again, this is something we've been doing with them for decades. I was doing it when I was on the road 20 plus years ago. We would go down and help them on that NASCAR weekend. It's just that one weekend primarily.
So basically 100% reimbursable.
Correct.
Can I get a motion to put this on the table?
I'll move it.
A second. Discussion.
I'm okay with it. I mean, it's one weekend. It's 100% reimbursable. That was my only concern, is that, budgetary wise.
All in favor?
Aye.
So moved. AP7.
JP7, seeking authorization to fill one vacant deputy sheriff position. This is actually the position which it essentially is a create and fill, but if you recall back when I had introduced this originally, you did move forward to create and fill because of the timing with the academy and a potential retirement, which left this position vacant. But this particular resolution, if approved, would add one additional position to my road patrol division. This is someone that I would like to assign to the civil division. As you might recall, I spoke to the fact that we were having some challenges last summer, getting to certain parts of the county, primarily Sterling and Fairhaven. We had some individuals that were starting to get a little upset because we were having trouble with quality of life issues, responding to those, and just the response times at extreme ends of the county. I did bring forward a proposal to add a couple of positions to my budget, which were approved. This was approved in my budget. We've always really needed to have somebody assigned to civil. We never have, but given the fact that we just continue to see an increase in the number of evictions that we have to process, civil papers to serve, and how dangerous really these evictions have become, as far as people are there when we get there instead of being gone and moved out because there really is no housing anywhere. Unfortunately, they're there until we go there to evict them, and that didn't used to be the case, but people are becoming much more aggressive. I thought long and hard about bringing this, forward in my budget. I understand the difficulty we're going to have with our budget moving forward, costs, but when I look at the fact that we have to assign 2 people to these things pretty much every time now versus just 1 deputy going out to these. Now we're taking another deputy off the road to deal with these evictions continually. As of mid-May, we were at 148. We were at 302 for the whole year last year, so we're going to surpass that number again. These are becoming more and more challenging. In January, during an eviction, the Portland County Sheriff's Office, their members got shot at. They ended up shooting somebody at an eviction. These things are going on right around us. We're seeing it. My concern is if I don't fill this and replace the position on the road, I'm pulling more people off the road. And at some point, we're going to have to let the public know if I can't fill this position or take care of these challenges, there's certain things we're just not going to be able to do. We're going to have to start letting the public know that we can't, respond to whatever your, particular quality of life issue might be, or vehicle and traffic reclass. But we're getting to that point, and I don't take it lightly that I understand the impact on our budget. But I also feel that the community has an expectation when they call for law enforcement services. This one I have to fill. I'm already working on assigning somebody to civil, but that pulls somebody off the road. So that's where I'm at with this. I don't know if there's any questions relevant to that, but that's where I'm at with this.
All right, let's start this. Let's make a motion for him to take that.
I'll move it to put it on for discussion.
Second, thank you. Open for discussion. No discussion? Okay, well, if there's no discussion, we're gonna go forward with the vote then. All in favor of JP7? Aye. I'm gonna vote yes on JP7. Do I have any opposing? Okay, I got 2 opposing. So JP7 will move forward to Ways and Means.
Division and department, right?
Yeah,
As it is.
that one made a motion to amend, so as it is, we'll move forward to Ways and Means. Yep. Okay. JP6.
JP6, again, bringing this resolution back to fill the position, which is essentially the corrections facility administrator, and also amend the title, which has already been approved by civil service. This is a position that is budgeted again. We've had this position throughout the course of my entire career here. I want to just explain that we have a mandatory minimum staffing level at the jail. Right now, it stands at 95.02 full-time equivalent positions. With that, I have 96 budgeted positions. This staffing analysis was done in 2002, 22 years ago. This particular position is mandated in that staffing analysis. Over the course of 22 years, we have not added staff in the jail, but we've continued to manage all of the mandates that have come down the road, including, I can name off some, but, the cap court program, I didn't ask for any staff with that. MAT, changes in expectations with our medical and mental health, services that we provide. The HALT Act, another thing that I wanted to bring to your attention, over the course of the last 22 years, we've had things explode in volume of work, like inmate grievances. Used to be, we had very few. Now we're servicing about 200 to 400 a year, depending on the year, where these are full-blown investigations. So I bring that up because I haven't come to you looking to add staff in the jail. I'm just looking to fill this position that is budgeted. We've had the position. I brought it to you originally in June of last year. I couldn't fill it because of the salary. I had hoped with the salary study at the time that that would be adjusted and down the road we'd be able to fill it. I couldn't fill it. The salary study, the salary wasn't adjusted. I came back in January with another resolution to fill it. I was asked to table it and work on updating the job description, which I have done, but it's an administrative position that I absolutely have to have in the jail. And you might ask, why do you need it after not having it for a year? If we lose somebody in a position like that, we have to pick up the work. It doesn't stop. And we've distributed those duties, including to myself. There's things that I'm going to be fully transparent, but we're dropping the ball on when it comes to reviewing our budget, reviewing invoices, when it comes to, reviewing contracts, when it comes to keeping in touch with other sheriff's offices and the feds, when it comes to keeping in touch with board ends, about board ends to make sure that we're pulling them our way. There's only so much time in a day. I'm trying to pick up a lot of that work myself with budget oversight, recruiting, hiring. I can't do it myself. The undersheriff's tapped out. The captain's tapped out. I know there's been kind of a push to eliminate this position, but we've been doing it for a year. Without it, I've got to have this position filled at some point. And again, I look at this, we're not fat when it comes to our mandatory staffing analysis. We're at 96 from 95.02 required. And that's the minimum. In 2002, that was the minimum number of people to maintain our operation. And we've done it all these years and continue to do it with that same number of staffing. So I'm asking the legislature to fill this position, because I wouldn't come to you if I didn't need it. I understand the pressure on the budget, but I can't ask our staff to continue doing what they're doing. And I can't continue to do what we're doing without this position in an administrative role.
I need a motion and a second with this in for discussion. I'll move it.
I'll second.
We have a second. All right, it's open for discussion.
I mean, at this point, I'm not ready to support this position. You're basing it on a staffing pattern from 2002. I did go back and look through the civil service that the first jail administrator was put in 1994. At that point, there was a jail administrator and a lieutenant, from what I understand. In 2010, it was when John Mack was promoted to captain. For all intents and purposes, it appears John Mack runs that jail. The administrative arm you have in that jail is John Mack and two full-time lieutenants, one over administration, one over operations. So at this point, I understand that you're asking for this to be filled. It doesn't make sense to me that this is the highest ranking non-uniformed person in the jail. You couldn't fill it because of the salary, but you're not asking to change the salary because likely you won't be able to fill it and you'll come back and ask to raise the salary. But for me, this is more about, it's been vacant for 14 months. I think we have enough pressures on our budget. We don't have to add to the staff at this point and then end up cutting. I would feel more comfortable. So I just can't support that at this point in time.
Can I comment?
Yeah.
If we cut this position, that brings us to 95 positions with our mandatory minimum is at 95.02. I'm sure we could probably try to make the argument that the 0.02, what is that really? But I'm a little concerned to make that argument with the state commission. And I would like to say that I'm really concerned about playing games with going below our mandatory minimum and having the commission come in and reevaluate our minimum staffing levels when we've added all these things, programming, the medical needs, MAT, the increase in grievances. Another thing they look at is over the course of those 22 years, how has your benefit time changed? How has vacation time allotted to individuals in the jail changed? That changes your staffing analysis because if people are off, you have to have bodies to fill the positions. So I'm concerned that that analysis, if they come in and do that, they could come in and say, we need 5 more bodies, or we need 10 more bodies. Not being fiscally responsible in filling this position, which in my opinion is part of our mandatory minimum necessary, is putting us at potential risk of having an issue with that and liability.
Is it fair to say, though, your minimum staffing analysis, it never gets updated from 2002? Don't things change within the operation?
It does, but my concern is I haven't requested one because I'm trying to be fiscally responsible. I don't think it goes down. When we've added all of this programming and all of these things we're dealing with today, I highly doubt it's gonna drop. I'm quite certain it's not, so I haven't asked for it to
You
be
do have
raised.
staff coming in from mental health and other places to supplement the needs in that jail, right?
Our mandatory minimums just deal with sworn staff. It doesn't deal with medical staff or any of the civilian staff. That's totally separate. Our
And they-
mandatory minimums just deal with a sworn staff. The state commission is saying you need 95.02 sworn full-time equivalents to run that jail.
From 2002.
Mandated from, that's minimum. That's the state saying an absolute minimum, this is what you need. And in 22 years, if you've been out to the jail and seen what we're doing, we've added a lot of programming, a lot of mandated things that we have to do. We've maintained that minimum. I know in years past, I don't think that this position was utilized to the best of its potential, but I can tell you over the last 5 years, a lot has changed in our jail with a lot of reforms that have come from Albany, mandates. We need this position. And I'm not sure why the reluctance to fill it, but we have to have this position. And I don't want to ask for an updated staffing analysis because there's no way that's going to drop. That's going to go up. And I could be coming back here asking for more positions from you. Not asking, but telling you we have to have them.
Sheriff, do you know of any other counties that have requested an updated mandating staffing report to see what that looks like?
I know that counties have, but I don't have personal knowledge of what's come back to them. But
And I would just be curious, like, if somebody had a mandate to come in and reevaluate that, you know, even 5 years ago, 10 years ago, what does that number look like versus 2002? You know, because you talk about it going and escalating up, which it probably does. But I would just be curious to know what that would
yeah,
be.
the commission can come in and do it on their own. The sheriff can request one. I don't want to request one because I think I'm going to be asking for additional positions.
You have 9 custody vacancies now. You're not hitting that minimum staffing pattern, is that correct?
We're not, but as long as we're continuing to recruit and try to fill those positions and we have them budgeted, that's fulfilling our role. Because every sheriff across the state is short on staff. If we said we're gonna start cutting the positions or not budgeting them because we can't fill them and we're falling below our minimum. You know, Sheriff Gould at the time, or maybe it was Sheriff Outhouse, one or the other back in the day, did receive a letter from the state commission when we dropped below our mandatory minimum, basically saying you need to fill your positions immediately. I just don't want to get into an issue where I'm not filling a mandated position and now I'm getting, you know, examined by the state commission and now coming back to you looking for additional positions.
Is any of this sheriff associated with the number of inmates? Do they take that into consideration when they do this staffing analysis?
It has to do with the, so it has to do with the particular posts, like, you know, if you have, like every post in our jail equates to a certain number of staff that have to fill that. It doesn't matter how many inmates are in the jail at a particular time, because that could change. Last year, we were full most of the year. This year, it's changed. We have a lot less, but it just, anytime there's an open post, it has to be manned. And I would love to look at reducing the size of our facility, but unfortunately with the HALT Act, that's really tied our hands and really shrunk the size of our jail, even though it's a 214 bed facility, because we can't just cram people in. We've got to have space for people to move around. But I can tell you, I wouldn't bring this to you if I didn't need the position. I understand the pressure on the budget. I'm elected, you know, I'm answer to the taxpayer. I'm accountable to the taxpayer. I don't want to unnecessarily come and look for things that I don't need. I need this position and I'm not asking to increase the size of our budget.
Sheriff Myers, this is an unfilled budgeted position at this time, is that correct?
Correct. It's in my budget. I've been trying to fill it since last June. I was trying to be respectful of the process of trying to work with the the salary study and have somebody look at that instead of coming to you and saying, I can't fill it at the salary it's at, I can't. And I know that I can't, but I'm trying to be respectful of the salary study coming and hoping that that gets adjusted appropriately, and then I can recruit for that and fill it, if approved.
I believe our first obligation to our constituents is public safety. To hear the argument that, our budget's tough, so we're not gonna fill a position. I guess if that's the stance we're gonna take, then anybody that comes with a resolution to fill a
It's
position.
been vacant for a
Fill it
year,
out.
1 year it's been vacant.
And we're dropping the ball on many things that somebody should be doing. I can't take on anymore, nor can the undersheriff or the captain. There's things that should be doing, and I lose sleep at night regarding liability too. There's a lot of liability in that jail. And some of you know that all too well, and what things have cost us when things haven't gone in the right direction. There's a lot of oversight that needs to be done there, and this is a position that's critical to doing that. Maybe 10 years ago it wasn't, maybe 20 or 22 years ago it wasn't. Today it's very critical. I wouldn't ask for it if I didn't need it.
Hold on, I'm sorry.
I just, you're throwing a lot out about the need for this. I just want to go back to JP8. I don't understand how we can lose anybody to go to another county to help out. So, I mean, we're okay with, even though it's reversible, like diverting resources. So I think we need to think about these things, because if you are telling us what you're telling us, that we should be taking every available person that we have and working our hardest to fill 9 vacancies, instead of diverting them to another county.
Can I comment? We're talking about 2 different divisions. This has the Schuyler County MOU has nothing to do with the jail.
Okay,
They can't work in the jail. It's totally separate.
I get it,
So that's one weekend at the NASCAR race in Schuyler County.
right,
I will be very honest. It's a nice little perk for our members if they want to go down and work a shift or 2 to be able to work the NASCAR race if they like that.
yes.
I do agree that we have to be very responsible when it's hard to fill shifts and provide coverage.
Right.
But it's a nice little perk for our folks with all that they deal with to be able to maybe go down and work a shift in a NASCAR race and be part of that, get right up front and be there. We haven't done it in the last 5 years, really kind of for that reason. I told Jonathan our priority is Cayuga County, and if there's a priority here that weekend, that comes first. But if we have the ability to let our road patrol folks go down for a weekend and work a shift or 2, great, good for them. But that's totally separate from the jail.
But I bring this up because JP7 is what you said. You were talking about the idea that
Mhm.
road patrol, we have to make sure that we're responsible, responding to all things in the north and south of the county.
Mhm.
I'm just saying, they're being diverted. That's just,
Just my last thought about this is, it just seems confusing to me that you think this is the highest paid or the highest in command, in the custody division. You're bringing it back with the salary at 70-some thousand. You put it out before, you got 8 or 9 people that met the minimum qualifications to look at, but none that you thought you would offer the position to. We're going back to the same, we're gonna advertise this. And the likelihood of you getting it is little until you come back and say, please raise the salary.
I'd be happy to come to you with a higher salary. I was
No,
just trying to be-
I talking out of both sides of my mouth at that point, but it just seems. At this point, I don't.
You're dropping me below my staffing minimum if you don't fill it, and I think that's a big issue for us to be doing that.
I think it's time to vote. Anybody else have questions?
I don't have a question.
All right.
I-
No, it's okay. Does anybody else from the committee have any questions? Any other questions outside the committee? All right. We're gonna roll call it because it is what it is.
We don't need roll call.
Oh, we can say, oh, that's.
Yeah.
Just thought-
Put it up on the wall.
Put up on the wall. All right. I'm gonna support this for further discussion, so I'm gonna vote yes on this. So all in favor, aye.
Aye.
All right, all those opposed?
Hang on now.
I'm sorry.
I
Well, no, I'm moving to, it's gonna move to ways and means.
Right, but we need to backpedal because I want to make a statement before I make my vote, so actually.
Oh, I'm sorry, you can make this, yes.
So I'm I'm just gonna make a statement saying, I'm not saying I'm supporting this, but my question is as far as the mandating goes. And the questions that I asked you, that is one of my concerns as far as if we go below the mandate of what we're supposed to have as far as the amount of employees, that would be a concern of mine. I'm going to vote yes to move this for further discussion because I do need to get some more information on this. But I just want to state that it doesn't mean I'm supporting or not supporting, but I will move it 2 ways for further discussion.
That's my vote represents further discussion.
yes,
Move it to
Further
ways.
discuss.
Yep. So, all right, so the measure has passed GPS. Okay. Can I get a motion to adjourn our meeting tonight?
I'll make a movement.
All right, all in favor? Aye.